Now tell me what is the diagnosis. What you can see here, that there is cystic swelling in the floor of mouth. It is bluish, so it resembles frog's belly. And can you see, it is lateral to midline. This is frenulum, so it is lateral to midline. Cystic swelling, bluish appearance, resembles frog's belly. So what's the name of this condition? This is ranula. So this is ranula, very very important. Okay, so this is ranula. It resembles frog's belly. Why? It's bluish, resembles frog's belly, and it's cystic. What is the location? Located in floor of mouth. It is in relation to which gland? It is in relation to sublingual gland. Okay, now see what's the problem. Ranula can be both mucus extravasation cyst and mucus retention cyst. What is extravasation? See, because of trauma or because of rupture, whenever there is spillage of mucin, and because of spillage of mucin, what happens? It is lined by granulation tissue or fibrous tissue. So this phenomena is known as mucus extravasation phenomena, and the cyst is mucus extravasation cyst. Sometimes there is obstruction of the duct and there is retention of secretions. This is known as retention cyst. So ranula can be both mucus extravasation cyst as well as mucus retention cyst, but most commonly it is mucus extravasation cyst. Clear? You have to remember that this is most commonly mucus extravasation cyst. Okay, in many books it's wrongly written that it is mucus or it is retention cyst. No, it can be both, but most commonly it is mucus extravasation cyst. So what's the problem here? There is mucus extravasation phenomena. It is associated with mucus extravasation phenomena. So what is the problem here? There is extravasation of mucus or mucin. Why? Because of local trauma or rupture. And this extravasated mucin in the surrounding tissue, it is lined by granulation tissue or fibrous tissue, leading to this cyst that's known as ranula. Okay, so see the clinical features. Here we can see what's the location. So it's located in the floor of mouth. What kind of swelling? You can see it is cystic swelling, generally unilateral or bilateral. So this is generally unilateral. And what kind of appearance? Frog's belly. So this is bluish. So can you see? And it is painful or painless? So it is painless, and you can see the shape. It is painless and dome shaped. So it's painless and dome shaped. Clear? So located in the floor of mouth, unilateral, cystic, bluish, painless, dome shaped. So how are you going to make the diagnosis? So you are going to make the diagnosis clinically. So we make the diagnosis of ranula clinically. So it is diagnosed clinically. Clear? Now see how we are going to treat it. We are going to perform the marsupialization. What is marsupialization? This is the ranula. You give incision over the cyst. So over cystic swelling, you give the incision, and after giving the incision, what? The content is sucked and the wall is sutured to the surrounding. Clear? So this is marsupialization. How it's done? So here you can see, first we are giving the incision over the cyst, dome of the cyst. After that, what we are going to do, the walls of the cyst are sutured to the surrounding. So I'm going to suture the walls of the cyst to the surrounding. So this is known as what? Marsupialization. So after marsupialization, suppose there is recurrence, in that case what should be done? Then we should excise the gland. Which gland? Sublingual gland, because ranula is a cystic swelling in relation to sublingual gland. So what's the treatment? Here you can see we perform marsupialization. Okay, and if there is recurrence after marsupialization, we go for excision. We go for excision of sublingual gland. So this is how we manage the ranula. Now see, there is another type of ranula in which there is intraoral component with cervical prolongation. So there is intraoral component with cervical prolongation. So this is known as plunging ranula. So in this ranula, you can see there is intraoral component. This is intraoral component, and here you can see that this is the cervical prolongation. Can you notice the swelling in this region? So intraoral component with cervical prolongation, and this is known as plunging ranula. Okay, just now we discussed ranula, and we discussed that ranula can be both mucus extravasation cyst or retention cyst. It can be both, but most commonly it is mucus extravasation cyst, and plunging ranula is exclusively mucus extravasation cyst. So this is exclusively mucus extravasation cyst. Exclusively. Okay, and here you notice what, again it is arising from which gland? So it is arising from sublingual gland. Now see, this swelling is having intraoral component. So there is intraoral component with cervical prolongation, and any swelling which is having this kind of presentation means intraoral component and cervical prolongation, what should be the shape? And it is dumbbell shaped. Clear? So this is dumbbell shaped. Rest of the features are almost similar like ranula. So it is bluish, it is painless, soft, fluctuant, dome shaped. Yes, lateral to the midline. Now see how we are going to make the diagnosis. Since it is having cervical prolongation, we need ultrasound or MRI for complete diagnosis. So what is required in diagnosis? Ultrasound or MRI is required. Ranula diagnosis was made clinically, but here we require ultrasound or MRI because there is cervical prolongation. In this case, since the swelling is in relation to sublingual gland, you have to excise the gland. Apart from excision of the gland, you have to aspirate the fluid from the sac. So what's the treatment? Treatment is excision of sublingual gland and aspiration of fluid. Aspiration of fluid from the sac. Clear? So this is how we are going to manage the plunging ranula. So this is all about salivary glands.